Let's go to this now. The Portfolio Committee on Health has decided to go ahead with the National Health Insurance Bill. Now, this is happening amid concerns over some of the provisions there. Let's now speak to Wits Social Security Systems Administration and Management Studies Chair, Professor Alex van den Heever, who joins us live now. Thank you so much, Prof, for your time. Your reaction to the latest development?
Well, I think it's unfortunate because quite a lot of submissions were made to the Portfolio Committee that challenged various sections of the Act, both technically and in terms of the overall policy framework. And it appears as though none of those inputs were taken into account. And as a consequence, the legislation is probably going to end up severely challenged. And I do note that the South African Medical Association has come out indicating their concerns and their opposition to the bill as it stands. And essentially, you can't proceed with a policy framework like this if the doctors in the country are against it. And there are a lot of issues to challenge. And maybe one further issue is that the state law advisors also indicated major areas of concern, and these were also ignored. So moving forward with this bill without taking these issues into consideration suggests that there is a lack of concern for the general public and proper public engagement on the sort of detail of the bill.
Concerns, I mean, also looking at the private healthcare providers also saying that, they're finding themselves potentially receiving the short end of the stick here. But listening to, over time, how this has been punted as a bill that aims to provide universal access to healthcare. But can the system cope, though?
The proposal as it stands technically can't. It's both institutionally and fiscally unfeasible, and is unlikely to achieve its objectives. It hasn't been properly thought through. There's been no technical analysis or feasibility assessment of any aspect of the proposals, and they're essentially being rammed through. It's very clear. The concerns involve governance of the fund, governance of the health system, which the current health system is pretty brittle as it stands now. And there are severe governance failures which don't require this bill. They require other interventions that have just been ignored for years. We're seeing the outcome of this all through the public health system. And many of the failures are not just isolated to the health system. They're in all aspects of the public sector. And the causes are very similar. They're about political appointments into the system, the centralization of decision-making. And if you look at that as being a problem, when you look at this bill, it's basically that. There's a concentration of powers in the hands of the Minister of Health, which the state legal advisors themselves have indicated is problematic, and many submissions have indicated are problematic. It is essentially exposing the entire health system to further systemic corruption. But there appears to be an unwillingness to address the kind of corruption that has resulted in a corrosion of 8 out of the 9 health provinces in South Africa.
And, also when you think about what has also been unfolding in this, particular sector as well, have been issues of underfunding. I mean, I was speaking to the South African Medical Association, for example, yesterday, and yes, we were talking about another issue, but this issue came in, and they say that for them, underfunding are some of the issues. And number two, they also are looking at the fact that you now don't even have the staff capacity to even be able to do what you need to do right now. And I suppose that is yet another area of concern.
Well, part of the problem of resourcing is the corruption. So a large part of the infrastructure budget just appears to vaporize into the ether. So you have to look, again, you can compare 2 provinces. You can compare Gauteng and the Western Cape. Western Cape has completely eliminated its backlog in Groote its backlog in surgery, whereas in Charlotte, they can't cope. And so surgery is queues and surgery is being cancelled all over the place. The systemic corruption, the Babita Deokaran story indicates the kind of corruption. It's syndicates that are operating with essentially a degree of political support. And that is part of the reason why the money just doesn't hit the ground. So the resourcing isn't just about how much budget is allocated. It's about the fact that whatever is allocated, a large portion of it is dissipated, either in corruption or just bad management. And this problem is not cured by these proposals. So resourcing depends fundamentally on protecting the integrity of expenditures within the public system. And right now, these are not protected in the provincial health systems at all. They're not protected, and that's the reason why many resource constraints are very apparent, and why crises are there in performance. So it doesn't mean that the state health services would not be resource constrained, even if you eliminated this corruption. But we would be getting 30 cents in the rand in the public health system at the moment.
And as a final question then, I mean, when we talk about, this particular pool, and you've alluded to the issues of corruption and all of that, one also thinks back to even, not only the Tembisa Hospital debacle, but also there's been issues even around the procurement of PPE. Now we're seeing even some of the hospitals themselves also, putting babies in cardboards and all of that. Now, if the system is not functioning as it's meant to, you certainly, as some have argued, cannot fix it with this particular bill.
This bill there's no relation to the kind of crises that we're seeing. And the moment you see crises in a health system, it means that all of that there is effectively dysfunctional management and broken accountability systems in place. And it is important to note there's a material difference in performance between the Western Cape and the other provinces. And that material difference, it needs to be noted. It is the difference. It is the Western Cape is reaping the benefits of a governance, of good governance, but we don't have it in the other provinces. But what's happening is people say this is because of resource constraints. It's not. It's because of dysfunctional management, no accountability systems, and systemic and endemic corruption.
Very worrying way to end off our conversation tonight, Prof, but do appreciate your time. That is the Wits Social Security Systems Administration and Management Studies Chair, Professor Alex van den Heever.